let's talk about immigration, the impact on the healthcare system. How can care providers attract significant numbers of motivated staff, particularly given the Brexit scenario as well? Let's just talk a little bit about that. I mean, what do you anticipate we can expect to see?
Well, we've been seeing it for a couple of years, which is generally a rather unpleasant tone from the UK population that they do not value immigrant carers in the healthcare sector. And unfortunately, they just need to go and go to a hospital, go to a care home, and realise that without immigrant workers, we will really find it very difficult to populate certain healthcare positions. Full stop. And over the last 2 to 3 years, most people who were thinking about coming into the UK have probably reconsidered it. And we've already had, for many, many years, issues with agency, particularly as you get away from certain urban areas. Going forward, in the short term, actually, the problem has been alleviated. And that's really only because of the economic recession and the fact that leisure, tourism, bars, restaurants, etc., retail, have been offloading huge numbers of people who now find themselves with the choice of work in care or don't have a job. And therefore, actually, in the short term, we don't have quite as big a problem post-Brexit than we might have considered should COVID not have occurred at all. That will be a short-term phenomenon. It may last a year, 2 years at the very most. And then, yes, I think we will have a major issue. And I think that's also why there will be some issues around domiciliary care, because it's not an efficient deployment of human capital. If you've got somebody going to one Mrs. Brown's house and then they've got to drive another 5 minutes to Mrs. White's house and so on and so forth, that's not a very efficient use of their time over that particular shift. Care homes, like hospitals, are generally quite efficient because you've got secured resources at a central location. They're able to be deployed in a flexible manner, and they are very consistent and well trained, and so on and so forth. But I do think there's going to be a real issue around the availability of staffing. Post-Brexit, one of the issues has been the thresholds around salary income, which defines whether you can come in as a sort of key worker or a favoured worker. And at the moment, the level that's been set really would not get anywhere close to the sort of salary that a carer, even a senior carer, would be able to justify. So you're not going to be seeing people who are firstly going to be allowed into the UK with effectively a green card or whatever we're going to call it, because in the rules, they just don't qualify. Yes, we might see some opening up to new markets that are outside the EU. We've always generally brought people in from Africa, Philippines, those sorts of areas. But again, we've got to look at a number of things. Is it going to be attractive for them to come to the UK? And when I say attractive, I think it's attractive around what prospects that they would have, what economic benefits they would have. But I think the big one is that we need to change our attitude towards immigration. Immigrants are not, in some respects, they're not dangerous to the UK economy. The UK is based on immigration. None of us really are, natives from the UK. We're all a mixture of something from whoever invaded us. And we've just got to face the facts that, without immigration, we will not have, in what is a low-tech, high-touch business, a continuing ability to deliver the services that we've delivered for many years.
Interesting point you made about the cost of somebody coming in to live in the UK, obviously bearing in mind the cost of living here as well. We've seen a lot of people, particularly Europeans, actually move back because it actually, them living here and there doesn't really make much of a commercial difference anymore.
The exchange rate is obviously critical to most people because they would be looking to send money back or certainly make money. And yes, there's a tension here because I can imagine going forward that there is a real desire to try and suppress the sterling exchange rate to make our exports cheaper, to regenerate the economy. But in doing so, if you're getting half as much as you were previously for your sterling conversion rate, well, yes, why not go to a Euro market, or the US, Canada, Australia, New Zealand? They will be willing to take you in, and obviously you're going to get a lot more for your euro or your dollar or whatever.
Obviously, 2020 investors were quite forgiving. What do we expect to see from investors moving forward?
I think they will have to make some choices. There'll be some people who will, lose faith in the sector, and therefore we may well see opportunities where people say, look, I'm just going to cash in, cash out. I just don't want to continue in this particular market. I think there'll be many who will say strategically it's still the right place to be, and will hold their assets for longer, and we'll just have to man up and accept it. COVID is not something created by anybody really. It's just happened, and it's extremely unfortunate. But it's a bit like the weather. Some people, I worked for Halfords for many years, and we loved a bad winter because we sold far more, washer fluid and snow chains and those sorts of things. But you'd have one year where you had a great winter weather, and other years where you didn't have it at all, and you just had to accept that was the way it was. So yeah, I think they will just have to get with it, and just accept that they've either got to be in for the long haul, or they're better off cashing out and selling up, and there will be people to buy.
Yeah, it's really interesting. You spoke about the seasons there and particular sectors. Pharmaceutical manufacturers and wholesalers of drugs will be having I suppose the shareholders will be pleased with the dividends this year, that's for sure.
And retailers as well. Food retailers have had a bumper year because people have been ordering from them. They've been more indulgent. People who run takeaway. But if you bought a takeaway business 18 months ago, you probably didn't think you were going to have the year you're going to have. But that's the nature of the world. If I knew what was happening tomorrow, I'd tell you what the lottery numbers were, and we'd all be millionaires.
What are the common failings and alert signals do you see that result in care asset portfolios becoming distressed? What are the key signals to actually look for?
It comes back to quality. You need to be having an underlying level of good quality, because if the quality isn't there, generally the wheels fall off the machine. I think the other thing I always look for is the management, and particularly the quality of the home manager and the management team. And many investors, I think they struggle to get their head around what a good manager looks like. The typical manager in a care home may well be a qualified nurse or someone who's worked through care, probably not professionally qualified in the way that people might think, but has got an awful lot of practical hands-on experience, and is sort of self-taught as opposed to being a manufactured individual. And a lot of investors struggle with that, and they struggle with the, dare I say, sometimes a sort of ambiguity and softness that you get in a care environment, where it isn't logical. People work for people. Why does this carer still continue to work here when they could get more money in a different job? Because they love the residents, because they really respect the manager, because they like the environment that they're in. It's those sorts of soft assets. But I would be looking, yes, at the underlying quality, the quality of the management. Just sort of go into a bit more detail, things like staff churn, agency, whether their paperwork is up to date, things like DBSs and those sorts of things, medication errors, safeguardings. And it's not just safeguardings in terms of how many they've got, but whether they've actually reported safeguardings and done something about it. Pressure ulcers, those sorts of lead indicators, and just the sort of stuff that you would see with an experienced eye. As I say, going round, what's the interaction between the staff and the residents? Are people up? Is the care person centered? Are people entertained and enjoying things? Is it more than just a functional facility? But those sorts of things investors often struggle with, because that's where informed management understands it from their experiences, not from a spreadsheet.
What's the key to a successful restructuring program, particularly during a pandemic or a crisis of this sort?
I think first off, you've got to have the right attitude to go into a restructuring. I think there's a lot of people who think you can turn base metals into gold overnight, and it's not going to happen. Just not going to happen. I think you have to have all the cards on the table, have the right team, And it is a team. There's many people who sort of present themselves as sort of some sort of solo superstar. That's not the way to go. It's got to be a clear team where everybody, investors, management, are committed in the same way, and I suppose both prepared and accepting that things will be uncertain. When you're doing a turnaround, generally you start with a real basket case, and quite often you just don't know what you've got. It's about being presented with a car that might look brilliant, and then you open the bonnet and there's something in the deep part of the engine that you would never know about. And I think also you've got to be prepared to make some tough decisions and make some quick decisions. I bought a distressed asset portfolio many years ago, and it was what it was. It was a portfolio, and personally, we should have acted a lot quicker to dispose of the assets that were not really fit for purpose from our point of view, to concentrate on a smaller business that was more profitable. And I think we often get people an attitude of turnover being vanity. I've never been in that camp. Cash is reality, not turnover. So yes, you need to have the right attitude and the right team, and it is probably about marrying the investors and the team together, because there will be certain teams and certain investors that marry well and others that won't. And I think it's important to have that chemistry between the two, that respect and that willingness to work together.
Do you think diversity plays a part in the restructuring process? What I mean by that is, do you think somebody from different sectors could easily come in and do a restructuring program having not worked in that sector, or is it essential to have that ecosystem background?
I would say not. Good people do good jobs, regardless of what background or industry they have. If you are a good people manager and you've worked in retail, there should be no reason why you're not going to be a good people manager working in the healthcare sector. Yes, I can imagine there would be certain occupations and backgrounds that wouldn't lend themselves well. If you were working in a legal office or legal firm, you may well find it quite different. Also, if you've been working in a manufacturing business, working in a services business could be quite a shift. We don't have inventory, we don't have machines, etc., etc. But generally, good people can turn their hands to whatever job or requirement is there in front of them. And I think also in turnarounds, quite often you need variety, because you do need to have that positive tension of somebody asking what may on the surface of it appear to be a completely stupid question, but actually it's the one that just cuts through. Why haven't we done it this way? Why do we do it that particular way? Now, there are certain things which you will never change in the healthcare sector, because it is a regulated sector, and regardless of what you might think, that is the way things are done. You go to the NHS, to a large hospital, and you are generally treated in one particular fashion, but that's because it's the NHS. Those sorts of things exist universally, and there's no point really balking against them. But yes, I think in a typical turnaround where you're buying a distressed asset, having variety and respecting other people's points of view and having that honest and open discussion is the best way. It's that more hands making light work type of thing. And if you're doing a turnaround, the first thing you've got to ask yourself is, how did it get to where it was?
Yeah, very good question. And talking about transferable skills, one that comes to mind is maybe somebody who's run a search business or understands, to your point about that people business as well, because ultimately you will need talent, and turnover is one of the biggest challenges in care homes as well. So just food for thought for somebody out there maybe watching this as well. And
I've recruited people from different sectors. I recruited a gentleman, hope you won't mind me saying his name, a guy called Narinder Singh. Background prior to coming into the healthcare sector was working in McDonald's and running McDonald's franchises. Now, a number of people are saying, what on earth do you think you've done? And I said, well, hang on a minute. This guy is working in a multi-site business just like ours, with large numbers of relatively lowly paid individuals who probably have a long-term career view about being in McDonald's. You've got customer service dimension, because you need to make sure that you are providing the service that people expect, and it needs to be consistent. And although you haven't got a healthcare or quality, there's an awful lot of stuff around food preparation, food hygiene, and yes, you could kill someone with a burger if you didn't cook it right or did something wrong, which is very, very similar to what happens in healthcare around, say, medication management. So yeah, he came in, he had fantastic processes and procedures which were with us, and he's gone on to have the rest of his career in healthcare. I recruited a guy who came from Green King, from the pub chain. Again, very similar transferable skills. But yeah, I mean, I've recruited people from all sorts of different places, and generally, I think if you see somebody who's good, they will learn. I always think there's two dimensions to people. It's the will and the way. Generally, people who've got the will get on and do it. If you don't have the will to start off with, you're not going to probably have the way.
Even from a board perspective, even from an investor perspective, bringing people in with diversity of thought. I think, there's that saying, if you carry on doing what you've been doing, you're only going to get the same results. Whereas if you start thinking and approaching things differently, and we talk a lot about diversity, and I sometimes hate having this conversation because people put it down to color, gender, and I don't believe it's any of that. I think it's diversity of thought, bringing somebody in who can come up with new, creative, innovative ideas, new ways of working, new ways of looking at the world, because that's what we need more of if we're going to tackle some of the biggest and ugliest issues that we have, irrelevant of age and gender and everything else that we talk about. Now, moving on to that, many leaders watching this will have some kind of change management experience. However, no one would have experienced a global pandemic of this sort. What management issues could this highlight and expose for investors that need to be addressed?
That's an interesting question. I don't think necessarily it's exposed anything new. I think it's really just accentuated or pushed forward. I think what I've seen here is it's really separated those who have sort of got a bit of get up and go and been willing to grasp the nettle and do something, from those who've been paralyzed almost as sort of animals in the headlights. And that's the case in any sector in the COVID situation. I can see some retailers who just sort of batten down the hatches and then wondered where their business had gone. Yet there's other people who've turned themselves into a takeaway, or they're doing home deliveries or whatever. I think the big things I would say is the resilience of the staff. You and the staff and management, and you've got to be there where you are going to be, or you have been seeing an awful lot of trauma and real genuine difficulty through this sector, through COVID. People have died. Not just hundreds of people have died, tens of thousands of people have died. People who you weren't expecting to pass away, or certainly weren't expecting to pass away in the way that they did. And so resilience of the team is absolutely critical to going through this particular situation. I think the other one is the willingness of the investors to trust management. I've seen in many cases, as soon as something starts to get a bit wobbly, let's get rid of. Well, I don't really see how that makes any difference, because the person that you've got there has probably got the biggest insight into why it is what it is. Yes, there will be times when you do need to change, but I think throwing the baby out of the bathwater has been a bit of an issue, certainly in this particular crisis. And I think one of the things that investors got to be very careful of is that it's been extremely tough over the last 12 months, and I think there is a waning resilience and willingness for senior leaders to stay in the sector, because it is very tough. If it's one thing to see your customers going to a competitor, it's another thing to see your customers dying. They're never going to come back. If you're a retailer and your customers go to the next door shop, you can try really hard and they may well come back to you. But once a resident has passed away, that is very, 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 very difficult for people. It's not unusual, but it is such a big impact this particular year. And I think, we're seeing people with burnout. There's a lot of conversation about the NHS and, burnout and, mental health issues, alcoholism and those sorts of things. Those have happened in the care sector generally, and particularly in care homes as well. It's not uncommon. They're just dealing with it in a maybe less public way.
Really powerful thoughts there for sure, for any investor to start thinking about. What I would just want to touch on right now is technology, and I know you've been a personal investor in technology as well. Other technology advancements are needed to assist in delivering care. Put Zoom aside and those TVs that you get where you can connect with your family. Where do you still see some of the gaps that potentially require potential solutions?
Well, the healthcare sector has generally been what I would describe as low tech, high touch. So it's never been an innovator or something which has been, developing new things. And largely because it's a follower, it follows other places. But I think what we've seen in the pandemic is a willingness by often connected elements to do things differently. So, for example, we've seen interactions with GP surgeries where they have done, Zoom conversations with patients, whereas previously they would always have come out. And that's really only been necessitated by the fact that the GPs don't want to come to the care homes anymore. So actually, the mother of invention, means that they have to do it in a different way. My hope also is that other things we've seen will continue. CQC have done again some remote assessment of care homes for quality standards. That's a much more efficient way of doing things, I think, from their point of view and also from our point of view. But I think more generally, there is probably in the last 2 years been a little bit of a glimmer of opportunity, particularly around medication management and care records management, which has always been a bit of a sort of great white hope around care homes. So we have seen now, I think, those coming to the front, partly because the technology has become easier and simpler. You're talking about people being able to do these things on their mobile phones, but there are some practical issues. I mean, in most care homes, Wi-Fi has always been very difficult because of the size of the places, or it's a converted property with very thick walls and those sorts of things. So I think we will just see a continuation of that. And what I would like to see also is some of the forms and processes being put into an electronic system. I remember early on in this crisis, Matt Hancock made a very unfortunate comment about care homes and fax machines, as if he was suggesting that care homes were in some way backwards. What he missed was the only reason that the care homes have the fax machines is that that's the only way this information can be transmitted to the NHS. And the NHS are the largest users of fax paper in the UK. So I do hope that we'll be able to sort of streamline and make some of these forms electronic, so that people can then accept them and have them transferred much more quickly and dare I say it, much more accurately as well.
Staying on that topic for a couple of minutes, I'm working with an organisation, a startup in India actually, and I'm sure you'll understand if I say tier 1, tier 2, tier 3 cities. And one of the things that we're looking at and we're working on is connected care, is being able to deliver connected care from your home at a cost-effective pay plan. Do you think we can potentially see something like that in the UK? And what I mean by that is being able to have, I know we already got some of that already, where you can be connected to a device and be given signals and reading. Do you think we'll see more of that coming alive, from 2021?
Definitely. I mean, I think COVID has prompted people to think about those, and actually there's been other applications which I think have parallel crossovers. I mean, the one I would look at is, in a way, the almost opposite to healthcare is fitness. And a number of people who have now got involved with electronic connected fitness is unbelievable. I mean, people who've bought a Peloton bicycle, or who've got a Fitbit, or who are on Strava or on Swift, where they are putting all of their data together. And then there's an analysis going on, and there's a program that comes out that says, you should be increasing your wattage to this, and so on and so forth. So I do think that we've got the capability to do it. Where we've always had the bit of the problem is that the audience we're dealing with, particularly at the elderly end of the spectrum, is almost the generation that missed out on connected healthcare or connected anything for that matter. And, we're seeing that come in a number of different ways, things like home shopping and those sorts of things. But I think if the NHS continues in the way that it has done, which is just really being forced by necessity, and people accepting that actually they've got a choice. Do they invest in a smartphone and put an app on it and learn how to use it? Or do they take the risk of catching COVID by going outside and interacting with somebody on a more face-to-face basis? So I do think there's opportunities, and you can see it already happening in some specialist applications, diabetes management. I've just been involved with a business where I've been a non-exec for a long time, and they've just won a contract with the NHS to do remote weight management programs. And this is smartphone or tablet or whatever based application where you've got input data, how much is weight, height, all those sorts of things, and it connects nutrition with exercise, with positive coaching, and it's a multitude of things. So there's stuff which are resource-based, so you go onto a website and you get it, but there's also interactions with people where you talk to them over Zoom or whatever.
Yeah, no, it's really interesting we talk about this, and we might have to have a offline conversation, but we're looking at connected healthcare, which prevents such chronic diseases. Looking further afield, which developing markets, both in the UK, so it could be a subsector, and also abroad, I know you've got international experience, would you be investing right now, and why?
Well, if I take the geographical areas, top of the list would be China. It's a large market, as you might expect. It's a monetized market. I mean, it's as Western as the West might ever be. I've seen more Bentleys in China than I've seen in the UK. And I think the big thing there is it's got a phenomenally aging population, like a lot of other, Far East countries, but it's got a particular quirk which has been hard baked into the Chinese population, which is the single child policy. So the single child policy started in 1979. So if you were a single child in 1979, you're basically about 40 or so. But structurally, you are a single child looking after two dependent parents. So as you age, and let's say there's a 25-year difference between you and your parents, let's say you're 40, your parents are now 65, you have a huge onus culturally on supporting your parents. But unlike now, and only recently now, you will have no siblings to help you, no brothers and sisters. So actually there's going to be a real pinch point in that generation. And we're talking, I can't remember when the single child policy finished, but it's only relatively recently. So you've got,
yeah, I think it's finished now. Yeah.
So you've got like 30 years worth of single children looking after aging parents who are just about to come to that point when they are going to need healthcare intervention, because their parents, somebody who was born, prior to the Cultural Revolution, in the sort of late 50s or whenever, probably a heavy smoker, probably worked in, domestic industry, and therefore not got great life expectancy or life chances. So I think there's a real opportunity there. And you're not talking about a market which is niche. People often say, well, what about New Zealand? Yeah, New Zealand, population less than Scotland. China, huge population.
Transferrable saying, going to China, 1.4 billion at the moment. Do you not see some challenges around, there's this stigma around going into China because of the way it's politically structured and led? Not raise any concerns? I mean, would you really want to go into?
Well, I think that's down to your own personal preferences as whether you're prepared to do business with, again, you could call them Chinese or you could call them communists. They are still technically communists, but they're not the communists I seem to remember from way back when. And every large market has issues with it. India, well, unfortunately, the British left it with a phenomenally complicated administrative system. And you've got inconsistency across India to the extreme that people will never really understand. So India is not the easiest place to go to either. So I don't know, you need to do your analysis and make your choices depending on what you feel you can cope with or you feel comfortable with.
Have you done any business in China yourself, just out of interest?
Yeah. I think like any market, you need to go in with your eyes open. The business I've done in China has generally been with Chinese partners. And as long as you sort of accept that they are always going to be connected to the Chinese Communist Party, and they will always be there with their best interests at mind, and it's not an equal partnership, and you can't own things in the way that you would own them in the UK, yeah, you pay your money, you take your choice. And the thing about the Chinese market is the size of the Chinese market is enormous, and the wealth there is also enormous as well. So if you're not too greedy, whereas let's give an example. Say you went into France and you did a 50-50 deal, you would expect 50% of the profits. In China, you may do a 50-50 deal and you may just have to accept 25% of the profits. But 25% of a very large cake is still worth having. And I guess it also depends where it is on your list of things. I mean, when I worked for Bupa International, we were operating in, well over 100 countries. I think about 133 countries. So actually, we hadn't been in China. We've been in Hong Kong for many years. And when I was there, we were gradually getting down to other markets, which were either emerging because they became a new market, or we looked at them because we were in adjacent markets. So we'd been in Hong Kong for a long time. Hong Kong obviously succeeded into China as a result of the legal agreement with the UK. So actually we were in China, whether we liked it or not. I went into Russia and again did a deal with a company called Ingolstadt to provide services into Russia. And actually what we'd seen in Russia was quite interesting, because there you had a prosperity that had emerged post perestroika, and also you had huge legacy health conditions which people wanted to insure against. If you go to Russia even today, the amount of smoking and drinking that goes on is phenomenal in comparison to what you would expect in the UK. But if you were to go back to the 70s in the UK, yeah, people would smoke 60 cigarettes a day, maybe before your time. But I remember when I first started my career, people would smoke in their offices quite happily. You would go to the cinema and you would be asked whether you wanted a non-smoking or a smoking seat. And I remember going in and thinking, well, if someone's smoking, everybody's smoking. You'd go on aeroplanes and people would smoke. So the world changes. To go back to your question, I think the other ones, when I talk about a UK perspective, I certainly think retirement villages are up and coming, and you can see that in the data and the activity that's going on. This idea of having a larger sort of extra care assisted living type arrangement where you've got people cashing in their bricks and mortar assets into a lifestyle, a little bit like the American style of retirement living, which gives them a good quality of life for probably maybe 20 to 30 years, which meets their needs. And I think we will see an increase in that. I certainly think there's an opportunity in the more specialist segments, because there are very, very few alternatives. Dementia care, particularly because you can't do domiciliary care with someone who has dementia. It's just incompatible. So you do need to have a residential institutional approach to doing that, and the staff that you require to really understand dementia and to really help people with dementia are few and far between. So you're not going to find someone with a really strong insight into dementia being interested in doing domiciliary care. They're much more interested in probably doing it in a residential setting, whether it be a hospital or a care home as well. And I think the final one is probably the regeneration of existing stock. There are a lot of care homes that are, even if they're purpose built, they're sort of Model 1 and Model 2 built in the 1980s and the 1990s. And I think there will be an opportunity to regenerate those, because they are not fit for purpose, particularly with COVID, but they are still in the right locations, got a reputation. And I think you will see people regenerating them, because the cost of land and replacing what they had already is so high that actually they're better off remodeling what they've got. And you can see that in people's own domestic homes. I mean, where I live, I see large numbers of people knocking down houses and rebuilding them on the same place.
One of the areas that we've been having conversations around is mental well-being. If you've done you see that as an up and coming trend as well?
It's always been there, but it's been very small in number. I mean, yes, you've had everything in the past. You've always had road traffic accident, acquired brain injury type of issues that have been to care homes, who have been typically younger people who have mental health issues as a result of, as I say, a road traffic accident or something like that. And you've had people with autism, Asperger's, those sorts of things, where again they have been in residential settings, but they've been quite small and very much in a community integrated arrangement rather than large institutions. Because most people who have early onset mental health issues will typically be relatively physically okay. You can bring into that category schizophrenia and those sorts of things. But I think what we're seeing now is more understanding of mental health issues. People are much more willing to talk about them and to understand what a mental health issue might be. And I think particularly with COVID, you've had a lot of people put under phenomenal stress. And I think we will have a legacy from COVID around post-traumatic stress disorder, around issues around burnout and so on and so forth. I would not want to be somebody working in an ITU unit in a large hospital dealing with COVID on a daily basis. It must be akin to being in a war zone, and I take my hat off to them. They really must be absolutely at the end of their tethers, really.
What's your current views on the current state of the market? What I mean by that, are we in a recession, bubble, depression, or either or?
Well, technically, I think we're in a recession, aren't we? Because it's like 2 periods of economic negative growth. So I think probably we are technically in a recession. What are we going to continue in? I think we're in, to use your term, probably a bubble, because I think we're just in a very unnatural place at the moment. All of the confusion and kerfuffle around Brexit, has, I think, muddied the water and made it very difficult to compare like with like. I'd probably say that give it 3 to 6 months and then we decide what we're into. But I do see it. I don't see us going back into a huge depression again, because I think 2 things. One is there have been lots of opportunities. I think secondly, everybody else is in the same position. So it's a relative term. And I think thirdly, there will be some upsides around Brexit, which can be manipulated, particularly around exchange rates and exports, and probably also around people just accepting that they will have a different perspective on the world. And there were some background things which make it different to other recessions I've lived through. I mean, I was telling my children about the interest rates in the sort of, late 80s, early 90s. And we are still sitting here having really been a beneficiary of 20 or 30 years of very, very low inflation and very, very low interest rates. And I can't see that changing. I can't see us going back to the days of double-digit interests and that sort of stuff. So, yeah, I don't think it's going to be quite as bad as maybe, I lived through the sort of early 70s when, the lights went off quite literally, and had the 3-day week. I don't see that going back to that sort of situation for sure, but I think we will have some short-term hardships.
Alistair, it's been fantastic talking to you. I didn't expect us to be speaking for such a long time, but thank you so much. If anyone wanted to reach out and connect with you, what's the best way forward?
If they approach me on LinkedIn, I'm open on LinkedIn. They just need to identify why they want to connect and who they are. And yeah, LinkedIn is probably the easiest thing to do. Just search for my name.
Fabulous. And we'll include your link in the description below. So guys, look, I hope you enjoyed that, understanding Alistair's views on the current marketplace in terms of healthcare and some of the predictions that he makes. So if you enjoyed this content, please don't forget to like, share and subscribe for conversations just like this. Also participate by commenting below your thoughts and views on some of the conversations we've touched on today. Also, let me know what topics and questions you have in mind and who are the business leaders that you would like to most hear from, and we'll be sure to get them on board. I hope you enjoyed today's conversation, and we look forward to seeing you in the next one. Thank you very much, and we'll see you soon. Bye-bye.